Hello and welcome to Early Bird by Amerisleep. I'm Dr. Devon Hoffman, and today we're going over sleeping positions for lower back pain. We've done the research so you don't have to. Now there's a lot of different reasons that we might have poor sleep due to back pain, and there's a lot of different back issues. So there could be a herniated disc, you might have a lumbar strain, you might have sciatica, you might just have poor mobility in some of the joints in the low back. So today we're going to be going over the top positions for how to sleep with low back pain, as well as how to sleep to relieve the issues that come with low back pain. So these are the top positions with different variations for side, back, and front sleepers that all can help to relieve back pain in different ways. Now with a lot of these, the thing that we're promoting is alignment of the hips and the back. Basically, if you are at end range, whether it's the hips, the low back, the shoulders, the upper back, all of these, if they're in end range rotation or side bend for long durations like 8 hours of sleeping, it can cause a lot of soreness and basically can build up into a little bit of back pain as you're sleeping or when you wake up. So with a lot of these positions, the main thing we're promoting is proper alignment. The first one we're looking at is side sleepers. So sleeping on your side, you're going to want to place a pillow under the top knee that you have up by you, basically to promote that hip alignment so that your knee doesn't fall toward the bed and start pulling on the left side or the right side of the low back. Now, fetal position can be a great one to stretch out the low back for a short duration. One thing that I will say with fetal position is a lot of people do sleep in it and they do wake up with some soreness in the back, and that's because a prolonged stretch like this for 8 to 10 hours straight can cause a lot of issues. So make sure that you're basically changing different positions if you're using fetal position, and ideally not using it for the entire night. Now, my number one position, if you're someone who can change positions all the time, have no preference, you just want to sleep without back pain, here's the number one that I've seen help relieve more back pain as a physical therapist, is sleeping on your back with a pillow below both knees, ideally maybe a couple pillows, to basically relieve pressure on the low back and put your pelvis in what's called a posterior pelvic tilt. Now this tilt basically relieves pressure and puts a little bit of stretch on the low back while allowing you to get a comfortable night's sleep and putting the hips and the back in proper alignment. Now for certain back conditions like spondylolisthesis, it can be helpful to have an inclined back support to basically relieve a little bit of pressure on the low back and put your body in actually an inclined position. So two ways to do this. One is to grab a ton of pillows and to kind of incline your whole upper body. If you do have it, an adjustable base like the ones they have from Amerisleep can be great to sleep in a very slight incline, which does place more pressure on the hips and sacrum, but does relieve pressure more toward the upper and lower back. So this is a kind of a trade-off, but I would say if you're having a ton of pain, try this one out. It can be a lifesaver.
Sleeping on your stomach can also be a great option for those that have bulging or herniated discs, and placing a pillow below the hips before you sleep is a great way to help relieve low back pain.
Now, just a quick tidbit, here are some other ways that you can relieve back pain as well. Besides sleeping position, make sure that you have a mattress with the correct firmness. The different firmness levels can really be preference, but making sure that you're trying different ones before you choose a mattress can be essential. Using Amerisleep's 100-day trial can really help to dial in which mattress is going to be best for your pain and also which one you like the most. Now, additional pain relieving techniques, make sure you're trying a couple simple stretches and exercises that we have on other pages throughout the website, as well as topical or anti-inflammatories can be essential. Make sure to check with your medical provider before trying anything. Lastly, here are some frequently asked questions that I get in the clinic and I see online a lot about low back pain. How long does low back pain generally last? So for, I would say, 90% of people, it's going to be intermittent. It's going to be gone within the week, maybe 2 weeks. For some people that it lasts longer, everyone has bouts occasionally in their lives where low back pain can last around 6 to 12 weeks or more. And this is a good time to maybe make some adjustments, go get it looked at, or make some adjustments in your interventions to overall get this low back pain treated rather than just wait for it to go away. This goes into our next one, when should I be worried about low back pain? So you really shouldn't be worried in almost any case unless it's really debilitating pain, gets into above a 4 or 5 out of 10 pain. If you're having low-level pain, this is completely normal. However, it is important to make some adjustments as early as you can to start figuring out the reason why you're having this pain. So going into an in-person medical provider, trying different mattresses, all of these are being preemptive about your health and can really help you to get out of pain as early as possible. Next question, how long should I rest if I have low back pain? Now, this is a good question because rest isn't actually suggested by medical providers or myself to relieve low back pain. A lot of times we have low back pain potentially because of too much rest, but a lot of times what we need to do is find which activities, which movements, which stretches, which interventions we can implement that are going to not cause more pain, but could potentially have a lot of upside. So doing little stretches that are pain-free can be great to relieve low back pain, and trying other interventions as well can be crucial. But allowing you to just kind of hang out and rest can actually cause more pain because of the sedentary nature of the low back. Now, why is my low back pain worse in the morning? So this can be a couple different things. Osteoarthritis or just general arthritis is very common to be worse in the morning. So if you have or know you have arthritis, very common to have more pain in the mornings. Nothing really to worry about, but it can be helpful to have a better mattress, to have a better sleeping position, and to get some movement in before you go to sleep or right after you wake up. Now lastly, does laying on a hard floor help low back pain? Now this is sort of a myth, but it actually does help some people because it provides a good amount of support and alignment to a low back that sometimes with a super soft mattress your back does not get. So that's why some people say that this works. If you do try to sleep on the floor, make sure to use plenty of pillows and use some of the sleeping positions that we talked about earlier. Making these adjustments, you're making great strides towards sleeping without pain. I hope these helped you out and get you to a better point of sleep, and especially help relieve some of that low back pain. Thank you guys so much for tuning in to Early Bird by Amerisleep. If you did find this information helpful today, be sure to visit our blog for more helpful expert opinions and information on how to get the best sleep of your life. Until next time, sleep well and take care.